At this moment, it is my honor to invite His Excellency Professor Dr. Muhammad Iqbal Chaudhry, Mustafa Prize Laureate, Coordinator General of OIC Comstech, to deliver the opening remarks for today's webinar. Sir.
Bismillahirrahmanirrahim. Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. My colleague Jabina has already briefed you about the participation from so many different countries, and this happens to be a very unique opportunity where we have the youngest speaker speaking to a very large audience. See, in comstech, we generally have an average age of speakers close to 68 or 70. And here we have Miss Salma Abu Saleh, mashallah, very brilliant young girl, delivering this very important presentation on a tool which is used by a whole range of researchers. She intend to present for 2 hours how SPSS is used. As I understand that this is a tool which was developed half a century ago, but this has been upgraded and made extremely useful and become kind of a wholesome tool from data analysis to data management to data collection and eventually results, interpretation, and reporting. And this becomes extremely important when people are engaged in research. Here she will talk about master's student, but I'm sure that this is useful for all, for PhD students, for BSS students, even professionals from different backgrounds. So this is an extremely important event. And this, I'm sure, will provide us the opportunity of updating young researchers with a tool which can help them immensely in improving the quality of the research. Because at the end of the day, large data sets can only make sense when you use right statistical tools. Salma Abu Saleh holds a master's degree in nutrition science from the Jordan University of Science and Technology. Since I'm aware of Jordan so much, and I've been visiting Jordan since last 40 years when I was very young, I know that this university, which was established in 1986, is among the top universities of Middle East, not only Jordan, but also in entire West Asia and in Middle East. And she has been the graduate of it, and she's currently working as a research assistant at Jordan University of Science and Technology with experience in research methodology, data collection, and statistical analysis. She's also a biochemistry lecturer at Al-Balqa Applied University, Jordan. And in addition, she's an online lecturer in maternal and infant nutrition at Rifa International University in Pakistan, and has completed 1-month comstech-oic research training fellowship at the Arid Agriculture University, Rawalpindi. Now, I'm sure that her stay for 1 month was productive, but most importantly, that she's among those young scholars who came for training, but have provided training to the people. So I know that our capacity has been beyond the objective of the visit. Ms. Abu Saleh also served as the director of mini PhD program at Reach Science, which I'm sure an organization which promote research project across different countries. I would like to say that her field is extremely important. Apart from what she would present, nutrition is extremely important, and comstech is launching a large program on clinical nutrition based in Mashhad Medical University. We intend to have several countries engage in it. This is going to be a multi-institutional multi-member state international collaboration to build not only the capacity in the field of clinical nutrition, but also to eventually develop projects which help in solving the stunning problem. Without taking much of a time, I'd like to invite Salma Abu Saleh for her presentation. I would encourage all the participants, online participants, and I'm sure that Jabina would be able to facilitate the interaction to make it interactive. And at some point of time, I would request Mr. Busale to kindly take a pause and take questions, because it's important that this interaction become productive. Thank you very much, and I would like to welcome you for your presentation. Thank you.
Thank you. Thank you, Dr. Iqbal. Thank you. Okay, I will share the screen just a minute, and I will begin with the. Okay, first one, I appreciate it to Dr. Iqbal. Thank you for the kind introduction of me. I am really glad to be here in this lectures. Okay, today I will be beginning of the about the SPS.
Your slides are not visible.
The share is you can see the introduction. Sorry, you can see the PowerPoint or no? No?
Not yet. Not yet.
Yes?
No, we don't see your slides.
Really? Why? Just a minute. Bismillah.
We did a test run. Maybe what you can do is that you can, okay.
No? Yes. You can see.
Not yet. Yeah.
Yes?
This is a program. This is the program.
Let's start the slide.
I know. Just this screenshot.
Okay.
Okay. Today we'll be explain the foundation of the SPS and the basic concept. This session is designed for helping master students or PhD student and the early career researcher to build solid, inshallah, understanding of the SPS. Okay.
So
Before
can you have a full screen right now?
Yes.
Just show a full screen because right now, okay, this is better. Thank you.
No? Okay.
It's wonderful. Thank you very much.
Welcome. Okay. I want to start before the beginning of the SPS. You should start of the talking a brief introduction or just very brief about why the research questions is very important. Before to beginning any statistical analysis using the SPS program or SAS or I program, you should know what the research question, what the type of the data. To beginning using the statistical analysis. Where's the any programs? SPS or program SAS. But in this session, just to talk about the SPS. Before the beginning of the SPS, you say why the research question is very important. The research question represented the main aim of the study, of any study. You can say the research question as the foundation of the entire research process. When the research questions are clear and were written, the data collection become more focused on the in the results. And
Miss Salma, your slides are not moving.
Okay. I don't moving of the slides. Okay. This is just introduction. Don't worry, Jabina. Okay. So again. Okay. When there is, I will again. When the research question is more is clear and well written, the data collection become more focused, and later on you can choosing the appropriate statistical analysis. Okay, and answer the questions more easier and also more accurate. Now, how to do we the answer research questions using the dependent on the data types of the data. We are plan to collect what that type of the data, the sources of the type data. You can sources of the data from experimental analysis in animal house or a lab result for a human, and also a questionnaire. Okay, a survivor. This is the items, or you can say this is the tool the collection of the data. In this structure and this lectures, just to focus on the questionnaire, you can say it tools or parameters. It's very important to choose a questionnaire that can accurate measurement of the outcome for a specific population. For example, it's your researcher study about stress, okay, or sleeping, or self-efficacy, or quality of life. Or you can just say about dietary habits. As the dietitian, we should know what the target population of in your study, and then search about الفت questionnaire for just you say stress, what the fits questionnaire to assess the stress among diabetic patient. I think is the major cancer stress. Or depression, you can using the patient healthy questionnaire depressions 9. This is the questionnaire is the for fit of the target population for example of the diabetic patients. Second step after to determine the target population and fit tools of the questionnaires of the self-efficacy, stress, quality of life. Second step, make sure use the question is the valid or not. What the mean valid? Valid questionnaire, for example, if the study make in the Arabic country like Jordan, Syria, anyone, you should using the Arabic version of the questionnaire and valid in the population in the Jordan. So just search about Arabic version of self-efficacy, Arabic version of dietary habit questionnaires, and if you didn't found the Arabic version of of this tools or this questionnaire, you should make using the forward and backward translation. Okay, this is the big method. Needed the several steps, but I cannot explain now in details. But it's very important to know you should using the valid questionnaires in the language of your country. Okay, is that valid in your country? Okay, so choosing a valid questionnaire and appropriate question is the critical point or critical step in research, because the good data, this is the text message, good data comes from what? From good question. So poor questions or poor data, you lead to the what? Weak result, even if your SPS analysis is perfect. Okay? Just as an introduction about, it's very important to use a good research questions, a good tools in the research question. After that, it's the very important to determine the specific or appropriate statistical analysis tools. Okay. Now, what's the difference between independent and dependent variable? You should understanding the variables. Independent variable, you can say independent variables or predictors variables. And dependent variable, you can say outcome variables or response variables. Okay, just you can see the left slides. Independent variables is the causes. You can say what we change or control. But dependent variables is the effect. For example, in this, you can see the pictures of the plant. Okay, what happens to the plant when the change amount of the waters? The waters in this, the amount of the water is the changes. So is in the dependent variable because it's the factors change. The amount of the water is the change. So the factors is change. The waters amount of the water is the independent variables. Predictors variables, but the growth of the plant is outcome. Why? Because it's affected by amount of the change. Okay, it change amount of the waters, you can say change amount of the water, it causes changing in the plant growth. This is the difference between independent and dependent variables. Does make sense? I can repeat. Just a minute. Does make sense to what the difference between a dependent and independent variable is very important to identify the independent and the independent variable, because later on when using the SPS you should type of the statistical analysis based on the independent and independent variables and the data and the research questions. Okay, good. Alhamdulillah. Okay. This is the mini quiz. Okay. Take the 2 minutes or 3 minutes to read the questionnaire, and you should identify the independent and the independent variable. You can write answer in the chat. I will read, or you can raise your hand and answer the questions. Okay, just 2 minutes. I think it's enough. You can see the slides. Just 2 minutes, answer the question. You should identify the independent and independent variables. Okay, shukran, Muhammad. You can answer 4 questions together, please. Okay. What's the meaning question 3 and question 4 is dependent variable? Some people answer dependent variable question 3 and question 4. You have the 4, I think, 4, yes, 4 research question. This research question is a different research question for the different study. Just determine or identify what the dependent and what the independent variables. It's the same questions. For example, a study wants to examine if the amount daily exercise affected the stress level among a university student. You should, in this research question, what the independent and independent variables. The independent variables is change. Okay, you say changes. Okay, the daily exercise exchange. So the daily exercise independent variable. It causes independent variables the stress level. Okay. Thank you, Asaba. Okay. The second question is, does screen time before bed affect sleep? Okay, I will prefer to read in last, sorry. Researchers are studying whether screen time before bed as just a minute, bed affect in the sleep quality. So whether screen time is the changes. So screen time is independent variables and the sleeping quality is dependent variables. Okay? Is there relationship between coffee consumptions and the student concentrations during the lectures? So, coffee consumption is the changes amount, different, a huge coffee, largest amount of coffee consumption or smallest or the medium is the changes. So, is independent variable. Dependent variables is concentration during the lectures. Okay? Does it make sense? Any question? Any question?
As
If you have any question.
participants are restricted to turn on the mic, so anyone have a question, please raise your hand. We will allow you to turn on your mic. Thank you.
Okay, just right.
Continue, Salma. People say no question.
Okay,
Chat box.
okay, nice. Okay.
Just go on. Good. Humaira Ramzan have a question. So Humaira, your mic is now unmute. हो गया sir? Humaira, you can ask question if you want to. No?
No. Yes.
Okay.
Okay.
Continue, Salma.
Okay.
Thank you.
This is the three research question. I will back to this research question later on, but it's the different, right? The research question. So the objective of the aim of the research question is the different. So first one, what is the level of the self-efficacy? Just a minute, because I have, okay. Where is this? Yes. What is the level of the self-efficacy in the managing diabetes among adult patients with the type 2 diabetes in the Jordan? So, level of the self-efficacy is the dependent variables, outcomes, among what diabetic patients in the Jordan. In this question, just to assess what the mean assess, what the level of the self-efficacy among target populations or the sample size in your study. The second question, is there the difference in self-efficacy between a male and female patient with the type 2 diabetes in the Jordan? Different is the comparison between self-efficacy in male and female. The same outcome, but the different research question, the different tools using in the SPS. Okay? The third question, is there an association between self-efficacy and glycemic control, or you can say HbA1c, okay, among type 2 diabetes patients in Jordan? So the same outcome, self-efficacy is the outcome, and have the relationship, association or relationship, if there any relationship between self-efficacy and HbA1c or glycemic control based on your research. So if the self-efficacy increase, the glycemic control is decreased or not decrease. Based on this questions, you should detect the tools in the SPS. Okay. What the mean self-efficacy? Self-efficacy is the theories the Bandura authors make the theories about self-efficacy. I think in 1916. I think. And this. And that's be times, years. Self-efficacy, that means ability or confidence of the patient or participant to make or to do a task or adherence of the behavior. This is the definition of the self-efficacy. For is the patient and diabetic patient to self-efficacy, to ability or to confidence, to task, to adherence of exercise or to adherence take the medications. Okay, this is the mean of the self-efficacy. Self-efficacy is the tools, questionnaires. I think have the two two questionnaires. First tools in 8 items. Yes, 8 questions of the self-efficacy to assess the self-efficacy, and another version, self-efficacy, you can shorter 6 items, just 6 questions to assess the self-efficacy. Okay. So I will back this slide every lectures or every get any new informations. So, okay, you know what the mean research question is very important. How to identify the independent with dependent variables, and another next step before to beginning the SPS, you should know what the types of the data. Okay, data when collected of the data, is the data categorical data? What do you mean categorical? You say nominal data or ordinal data. Categorical data, just the questions like gender or sex, is the female or male. This is the categorical. You answer the 2 answers or 3. Female, male, or you can say smoking. Is smoking yes or no? Body mass index, normal, overweight, obesity, underweight. Okay, this is the categorical. You can say nominal data like female والmale, body mass index, or ordinal data. Ordinal data is the a range from big to small or to small to big, of high to low or low to high, like grade in the university, excellent, very good, good. Okay, so this is the ordinal, at the same categorical. So the first type of the data in using in the questionnaire or in the SPS is categorical data. You can say quantitative data, no unit, just yes, no, normal, abnormal. You can say HbA1c, normal or abnormal. When the answer normal, abnormal, so this is the data is the categorical data. You can say nominal data. Okay, in numerical or quantitative data, this is the continuous data. What do you mean continuous data? For examples, age. Age, you can ask the question for participants age. Some people 18, 29, 28. So this is the continuous data, just the numbers. Okay? You can say continuous data. You should determine what the type of the data, because the type of the data is the different using the statistical tools between the numerical data and the categorical data is the different. Okay, any questions? Any question? You have any question? Just a minute. Okay, I will back. Okay, again explain self-efficacy. Just okay, no question, just a minute. Mavira, what the question? I have a question. What the question? Okay. Last question. Okay, I will back. Mavira, a public health team. This is a question you cannot understand. Yes or no? Okay, I will explain. Just a minute. Just a minute. Okay, the last question about the public health teams went to the public health in any country, want to check if the gender influence says how often people eat fast food. Is the gender influence how the people eat the fast food? Is the influencer الgenders المale والfemale to eat fast food? So what's the difference? Sorry. What difference between independent and dependent? Dependent variables is fast food because it's the come, not change is the eating a more fast food or less fast food. Genders is independent variable. So because it's different between male and female. Okay? Does make sense? Does make sense? Yes, okay. I back to the questions, just a minute. Okay. Okay, again, explain self-efficacy. We do not understand it clear. Okay. Self-efficacy is the theory. Okay. Authors, I think this is author name Bandura. Just this is the some questions. I think the first version of the self-efficacy just 80 questions to assess the self-efficacy. What that means self-efficacy? Just ability and confidence, the person ability and confidence to do or to make a task or adherence of the behavior or no behavior. You can ask the patient if to adherence of the exercise every week, 30 minutes. If the patient answer from 1 to 10, if the patient answer or participant answer 8, is the very self-efficacy, the patient very self-efficacy to do this behavior or to do this task, okay? Just this is the self-efficacy. You're using the self-efficacy more in the public health. Okay? Okay. Okay, another question. Clear. Okay, welcome back. Okay, it types of the data. Okay. Okay, you again, you should determine the type of the data is the categorical data or continuous data because it's very important to determine types of the data. It's possible change of the type of the data variable into another one. You can change it if the variable of the data is the continuous data. You can change it or convert it to the categorical data, but not categorical data to continuous data. Okay, this one directions. So you say numerical continuous data. Numerical continuous data, it's just you can say continuous and discrete. What the difference between a numerical continuous or numerical discrete is the just the numbers, but the continuous, for example, the not age, sorry, you can use the age, but in the weight the weight 13.2. This is the continuous data. Discrete data, just you say the 13 kilograms, okay, without discipline. So you can convert the data from numerical continuous to numerical discrete, then categorical. Like age, you can convert the age. The participant 13, 20, 17, based on the years, okay? You can convert it as the continuous data to the categorical data. But when they ask the questions for age, just check in your group age from 20 to 26. To 22 to 13, for example, or 13 to 14, this I cannot convert its age to continuous data. Okay? I can write the example. I think is you can see the slides or not?
Yes, we can see the slides. So you can.
Okay. I will write. I wanted to write. Okay. Age. You can ask in your research age, just as like this. Some people answer 20 based on your 13 based, okay, extra. But when another study, some people using or some author using the age as the questions age in the categorical first one from 20 to 23. Okay, like this. Okay, this is just a minute. Okay, this is the first one. 13 to 14, 41 to 15, for example, okay? Or some study using this. Just answer what the age, specific age, or these groups. The first question in the type of this in this study is very clear to converted the numbers just for 10 to from to continuous to categorical data. But when using these styles in your research, you cannot convert the data from categorical data to continuous. In these questions, the age when to answer 2023, check just in your age in the period. Any period, just I cannot convert the data from categorical to continuous data. Okay? Does make sense? Okay, excellent. Okay, I will back. So I prefer is the different from author to researcher, but I prefer to collect the data in the highest level in numerical or continuous or numerical distance, as it's the more accurate because I can easy to categorical later on if needed. Okay? Like الage, البودي الweight والhigh, I prefer as the number because you can convert it to categorical, but the categorical data I cannot to convert it to continuous data. Okay? تمام. Okay. Now, to beginning the introduction of the SPS. What the mean? SPS is in the past, you can say SPS is statistical package for social science. Later on, to change statistical product and service solution. Okay? SPS using for what? Okay, SPSS, it's the popular program to statistical analysis. It's very famous and very easy comparison between the R or SAS programs because do not need the write the equation. It's used for the data or coding, you can say coding. It's used for the data entry, management, and statistical analysis. Very common in the healthy, psychological, education, social science. You can using this programs. Okay. What is used for SPS? Using the SPS to describe data using descriptive statistic like frequency, mean, minimum, standard deviation. I will explain that, inshallah. Examine relationship between the variable, with the relationship between the two variables like stress and what you can say, stress and consumption of the coffee. Okay, the comparison between groups like this research question, what is self-efficacy between, what the difference self-efficacy between the gender. So the comparison between the two groups, female and male. Okay, now you're gonna talk the basic structure of the SPS. The SPS have the two window. First window, data editor, and the second window, the output view. A data editor create variables, enter data, and carry out statistical functions. The output view show what the result are produced by analyzing the functions. Okay, the output just show the result. Okay, the data editor creates a variable, enter data, carry out a statistical function. Okay, the data editor have the two tab. First one, a data view and the variable view. Okay, I will open the SPS. Just a minute, I will share another. Just a minute, please. Where is the share? Okay. I will share everything. Okay. You can open a new SPS. Just write SPS, the program. I'm using the 25. You can using 24, 26 or 27. But 25 and 26 is the variable as free. Okay? At the same, not different between so this is what the data view data, and this is the outcome just to produce or to show the result in this questions. Okay, data, you can say data view from here and the variable view in here. Okay, what's the difference between them? A data view from the two column and practical variables, raw individual case. Okay, a variable view, you can see a column and a row. A column is a specific characteristic. I will say what the self is characteristic that, and row individual variable. Variables, you can say variables, the questionnaire or factors using in this study. Okay. A row in the variable view are the same a column in the data view. Okay. So this is the variable view. You have the name. In name is the you can say
Salma, we can't share the we can't see the screen. We just see your downloads file. Like,
really?
yeah,
Oh my God. Our screen is
we can't see
screen
the file.
everything.
We just see the file explorer downloads.
Really? Why? Just a minute. Okay. How to make the share everything? Why cannot share everything?
You can share it again. Maybe it will work.
Just a minute. I think it should share everything. How? Okay. This
Yes,
is the
now
SPS.
it's visible. Yes, now it's visible.
Okay. This is the you can see this. Okay. This is the data editor. The data editor have the two tabs. The data view. This is the data view and the variable view. Okay. Okay. You should back to the screenshot. Jibina, I am so sorry, but Jibina, you can share everything.
What happened?
Yes. I can share everything.
Yeah, sure.
Yes, I know, but why don't see everything?
Maybe sometimes screen gets stuck, so don't worry. There is no problem. So now you can back to your presentation slides.
Okay. Okay. This is the data view, and this is the variable view. The data view just the column and practical الcolumn is the practical variables. What do you mean practical variable? You can say الquestionnaire, الage, الgender, question number 1 for self-efficacy, any questions. Okay, الrole individual case. You can individual case. What do you mean? For a human study in the participants or patients, this is the individual case. Participant 1, participant 2. الvariable view is the create or defined various variables. الcolumn specific characteristic, الcolumn and the role individual variable. الrow in the variable view are the same الcolumn in the data view. Okay? Okay. In name in the data view, you can write the questions or the factors without space. Any space lead the error. Okay? In this name. Label, this is the label. Okay, a label you can is more specific for a question or more details about a question. For example, I using the stress questionnaire. For example, cancer stress questionnaires. This is the 10 items to assess the stress among a diabetic patient or any patient, chronic disease patients. Okay, you can write in the name care number 1, care number 2, care number 3. Okay, more easier. In the label, you can write all the questions with the space. It's okay. Okay, this is the name and the label. المجرز, you can say the measures in here. Okay, المجرز you can determine the measure based on the type of the data. If the data nominal, categorical, you should select the nominal. If the data ordinal, excellent, very good, good, or Likert 5, strongly agree, strongly disagree, using the ordinal data. If the data continuous data or discrete data, using the scale data. Okay? we will blind inshallah in the SPS now. Okay? بس and it types in here, it types just the type. You have the two major common of the type of the data. In general, SPS using just numbers, but sometimes you needed just using the data without numbers. Okay, using numerical if the data numbers like continuous data, weight, high, age, and categorical data like male, female, you just converted from male is the coding 1, female coding 2. This is the number. Using that type is the numeric data, numeric. But sometimes you should name city. I have the huge name of the city. You can keep it without coding the name of the city or a name of the student or a name of the participant. You should determine the type of the data as string. Okay? Any questions? Okay. How to open the data? When they open the SPS, you can open the data from file, import Excel sheet, or the copy paste. I prefer to copy paste from Excel sheet to SPS. Okay. I will share the SPS. Okay. This is the SPS. This is the data view. Sorry, a variable view. This is the data view. You can export the data from file, import data from the Excel. Okay. And using any Excel sheet from here and the okay. Or can copy paste of the SPS of the Excel sheet. I will. Okay. When they make the copy paste, you should paste with the variable name. Okay? This is the data from Excel sheet. الage والHbA1c. Okay. الage is continuous or categorical data. الage is continuous or categorical data. Continuous data. Okay. والHbA1c also continuous data. Okay. This is the continuous data. You can go to the variable. This is the name, الage. Label is at the same age. HbA1c, you can, you write A1C is the, and in label you write the HbA1c. This is the type of the data numeric because it's the numbers, not text. Yes, you can convert it the age or HbA1c as the categorical data. I will explain that also, inshallah. Okay, المجر is the continuous, so you should scale, not, you should scale, not nominal. A1C also continuous data, you should using the scale. Okay, this is the data view and this is the data variable. Okay, after that, like الجندر just a minute. Okay, الجندر is female and male, just the two categorical. الجندر female, male. I will told you the 0 is the male and the 1 is female. Okay, so you go the variable view. This is the gender, the label is the gender at the same. Measurement is nominal. Okay, this is the categorical data or continuous data, gender. Categorical data. So you should value what the mean 0 and what the mean 1, or what the mean female and what the mean male. So in this data 0 1 0 value in SPS, what the mean 0, I will say for you 0 is the mean male. Okay, just from value to edit it, and 1 female. You can using 1 2, you can using 0 1 based on your based on you. Okay, 1 male and 1 female and 0 male. Okay, this is the value. So you can back to the data view just using the A1 in here. Okay, you can explain what male and female, 0 and 1. Okay, this is the categorical data. Does make sense? Okay, you can see how to convert it from 0 1 or male female from here. Okay, this is the categorical data, this is the continuous data. Okay, you say in the using 0 1 for coding that data. What do you mean coding data? Coding data just labeling if the questions like gender, female, male. So I wanted to say male is 0, female is 1. Or the smoking, yes to no, I will say yes is the 1 and 0 is 0. No is 0. Okay? It's the make easier statistical analysis and help maintain the names. Okay? Okay. Also you should take, okay. Just a minute. Okay, how to make the coding of the data? You can make the coding of the data in SPS, but I prefer also making the sheet in the coding the data in, you can see SPS now, coding the data in the Excel sheet. Okay, how? I will share. Just a minute, stop share. Okay, you can see the Excel sheet. Yes, okay. This is the Excel sheet. I will export it from Google form of this questionnaire about the gender, the age, HB1C, K1, K2. I will say the K1 is the cursors to assess the stress from K1 to K6. This is a questionnaire. And CE is the meaning is self-efficacy of the self-efficacy questionnaire number 1 to questionnaire number 8. Okay? This is the data. I prefer to cleaning of the data first one in the SBS, converted genders. For example, some genders you say female, male, from to transported the Google form. When the 0101, I will say converted from female to 0 to 1 and male to 0 in here. After that, you should go coding data. Coding that, you say coding book. Just the first question, I have the first question age, okay? Is the continuous data, you don't need the coding for the age. But the gender, you can say 0, what the mean 0? And what the mean male, okay, female, sorry. 1, okay? البody mass index or what are you say? البody mass index. What the mean body mass index is 0 is you can say based on your how to make this is 0 you can say underweight. I will repeat underweight. And the 1 every questions I prefer using this for you. You can back to the Excel sheet later on. Okay, the coding book, you say not coding data, coding book and the Excel sheet of the just labeling what every questionnaire, what the mini questionnaire is the questionnaire continuous data. So okay, but is the questionnaire is the categorical data, you should labeling of the every answer of the questions. Okay, you say coding book in research. Okay. Okay, so this is the sheet, female and male, social or more questions. So you can convert the male or female from Excel sheet or in the SBS. I prefer, my opinion, to convert the coding data or labeling data in the Excel sheet to avoid any problem occurs in the SBS. So you can just explain, sorry. Where is the find? Find and select, replace, find, female, replace 1, replace all. So all the female is the replaced, male 0. Okay, sorry. You can using 1, 2 or 0, 1. I prefer using the SPS 0, 1. Okay, because in the regression or the advanced statistical analysis, I prefer using 0 and 1. Okay, this is now the genders is converted from the text to numbers 0, 1 and go to the SPS. Okay, does make sense? Any question for that, for this? Okay. The coding data and the cleaning data is the very important step before to beginning statistical analysis also. Okay? Any question? Okay, you can ask. You needed to convert the data into the code based on the type of the data. Is the categorical data, you should make the coding or labeling what the mean female as the number, because that is the easier using the number in SPS for statistical analysis. Okay, sometimes when using the advanced statistical like regression, linear, logistic, anyone, you should using the numbers just, not the text. So you should convert it the text, female, male, normal, abnormal, yes or no, strongly agree, strongly disagree, to the numbers. Okay, this is the numbers you can take and any numbers, but prefer in the SPS using 0, 1 if they have the two categorical, on the more categorical 3 or 4 from 0 to 1, 2, 3, 4. Okay. Okay, I will repeat. Any steps I will. Okay, I will be again. First one, you have. Okay, you have the Google form to convert to collected of the data questionnaires from the patient, from any participant, and after that export the Google forms to convert it to the Excel sheet in your desktop. Okay, so the desktop they have the raw data. You can see the Excel sheet now. You can see the Excel sheet. Yes. Okay, this is the raw data. Okay, you can just back to gender and female. This is the raw data from patient to answer the questions. Okay. Okay, this is the raw data. So you have the genders, female and male. You should converted male and female as the number coding. What the mean male as the number? You can say 0. You can see 1 based on your opinion. Okay, and the age continuous data keep it as this because this is the number. Is social, married, single, others. You can convert it to 0, 1, 2. Living status with the female and the alone, you can coding converted, that is the numbers. Income, this is the number, but this is the period number from 13 to 300 to 500 to 500 to 1000. Okay, this is the categorical. Okay, income in here is the categorical. You should convert it to the numbers. You can say less than 300, 0, from 3 to 500, 1. Okay, HbA1c is the continuous data. Keep it like this. Okay, first question number 1. This is the question is a different scenario because it says the valid questions. What do I mean valid questions? Valid question is the valid in your language or public population, but you can back to the recent study or original questionnaire, and what the mean none of the time based on your authors write these questions. Okay, not you, based on you, based on the authors write the question based on the time. What they mean based on the none of the time, what they mean some of the time. You can back to the literature review. Okay, but another question as the demographic question or any question to write, you can use any labeling. Okay, does make sense? Okay. Yes, is the difference between a name and the label. No, you can using at the same, but in the name in the data view, you should using the any space. You write body mass index as the like body mass index. You cannot using the any space. Okay, but the labeling you can using the space. Okay, at the same questions. Okay, yes. Some people to faces of the problem when the export of the data from Excel sheet to SPS. I told it you. I prefer using the copy paste from when the cleaning of the data in the Excel sheet and make the coding book in the Excel sheet. Just copy paste in the Excel sheet to SPS. Okay. Okay, we're making the coding data for you, not for SPS. Later on, when you back back to this research and using some data from this research to make another papers, okay, for you, not you cannot use it. You cannot you don't making the coding book, okay. But I prefer, Selma prefer to coding book and Excel and save the data from Excel sheet as the cleaning data and the raw data and the coding book and make also SPS. So in SPS, when the go to the, this is the data, gender 01 and K1 to K6, this is converted from the numbers, raw data to clean data with the cloud, just to copy paste in the SPS. Okay. Bismillah. Using the paste with the variable name. Okay, you should screen of the SPS. Just a minute. I'm so sorry. Okay. Okay. I will go to the copy paste of the age, gender, HbA1c, K1 to K6. This is a questionnaire to assess the stress. Just copy paste. Paste, not paste as alone, paste with the variable name, okay? So, gender, age, HbA1c, K1 to K6, okay? You go the variable view, age is the numeric type, okay? Labeling genders, okay? The value is the continuous, so at the same. You measures or you can just select the scale, okay? Sorry, this is the genders, sorry. The value, so you can using values 0, what that means 0? Male and 1 female. Based on the coding data in Excel sheet, okay? Age, gender is the nominal, sorry, and age is the scale at the same. HbA1c also is the scale because it's the continuous data. K1c, you have the answer 1, 2, 3 because I converted from none of the time, little of the time, some of the time. So what they mean? I will back to literature review. What they mean 1 and 0? You can say 1 is the none of the time, 2 little of the time, and 3 some of the time, and 4 most of the time. Okay, just to make from here 1 value. What the mean answer? Question number 1. If the patient answer none of the time, you say none of the time. Okay. None. Added. Okay. 2. What the mean 2? Little of the time. You can make the space 3 some of the time. Okay, based on the literature review of the Kelser. This is the questionnaire K1 to K6 is the Kelser questionnaire to assess the stress among the chronic patients, especially in diabetic patients, but you can using in the another chronic disease. Okay, for most of the time, 5 all the time. Okay, just okay. All the question at the same answers. You can select the same answers. So copy and paste everyone. Okay, everyone. Just paste. Okay. I write K1, but with the question K1, you can in the labeling write the question. What the question asks of the patient. K1 is, do you feel nervous? This is the questionnaire. So you just scan the labeling, right? Okay, the questions. Question number 2. Do you feel hopeless? Oh my God, just a minute. Okay, from here. Okay. Number 3. Did you feel? Just copy paste of the questionnaires. For you, you can statistical analysis without label, okay? Just you should, it's very important the value and the measurement. But for you to be more easier, to be more smoothly, to be more accurate, I prefer to data in SPS is the more, you can say, clear and clean. Later on, when we back this is the questionnaires or this is the data, to understand what are you going out, what are your research do. Because you some researcher, you can back the data collection after the 1 year or 2 years. Okay. The last questionnaire. Il measures is the from 1 to 5, so nominal data, categorical, because this is the categorical, nominal, and minimal. Okay. Does make sense? Any question for here? Any question? Okay, just a minute. Okay, الويدث tab. Okay, this is the when they have the write the big questions, okay, or the big answer. Sometimes when the using the string, not numeric, of the name of the country and name of the student, you have the right all the name of the student or name of the participant. Okay, Salma, Yas, Abu Saleh. So this is the width is the very small h. We should just increase the width to 26 to 27 and converted the type is the string. Okay. Does make sense? Because gender as the gender. Don't have them more explain what the mean gender. Gender. This is a question gender. HbA1c. You can say what the amount of the HbA1c. HbA1c is the HbA1c. Age is the age. But K1, you can, this is the questionnaire, okay? Just to explain what the questionnaire K1. Okay? تمام. Okay, I will back to screen of the presentation. You can see presentation. So opening of the data, you can opening of the data from import data Excel, or you can using the copy paste. I prefer using copy paste. Okay, coding data in the SPS is very important. Why using the coding? To convert the qualitative and non-numeric data into the quantitative numeric data form. You can using that, or make easier to run a statistical analysis and help maintain constantly of the data entry and the analysis. Okay, cleaning the data. What the meaning cleaning of the data? Cleaning the data to detect is the error or the missing value. Sometimes some people to answer the question age, don't write for 15, you write 500. This is the wrong data. How to explore the wrong data? I would say using the descriptive statistical, okay? Handle blank or outliers, any outliers to ensure accurate analysis. This is the cleaning data, okay? The first one, when they go to the analysis using descriptive. What do I mean descriptive? The purpose of the descriptive, summarize and describe the data. Okay, summarize and describe the data. Also descriptive, using the descriptive first, so summarize, to check if the data is, all the data is cleaning. Don't have any numbers is the not correct, like the age 500. What do I mean 500? Is the correct? Is the not correct? Okay, descriptive and the purpose, summarize and describe the data using المين, الميديان والمود. المين, الميديان, mood using when the data is the continuous data. So it's very important to determine the type of the data, because when the data is the continuous data, you're using descriptive statistical for mean, median, mood, just to summarize or describe the data. For example, age is the continuous data. So what the average of the age in the, or how to describe the data of the age in the in diabetic patients in Jordan or in Pakistan, you say you're using the mean. The mean is the average, okay? And a range with standard deviation. The standard deviation who expressed is the data is the relation to the mean, okay? Okay, you how to make this from analysis, descriptive statistical. Okay. Also using the frequency and what the percentage. I don't know. I will back to SPS and apply this. Just a minute. Okay. You can see Excel sheet. Sorry, SPS. Just converted the numbers to coding, labeling, or value from here. Okay. So, how to descriptive to describe or to summarize of the data. First one, age, HbA1c is the continuous data. You can see, go to the analysis, descriptive analysis, descriptive, just age and gender, because it's the same type of the data. You can option, what the mean in the option? mean, standard deviation, minimum and maximum is the lowest and the largest numbers in the age and the HbA1c. Okay, just continue and okay. You can see output or no? I think no. Okay. No, you can see the, just a minute. No, okay. I will stop the share and share the screen of the output. This is the output window. You can see. You can see the output window. الage and ال HbA1c descriptive, المين والمين والمينيمم والماكسيمم والمين standard deviation, because it's the continuous data. How to read the box? How to just you have the question? Okay. How to read the box? Okay. How to read the box? In N is the numbers of the participant. Sample size. The sample size is 398. Okay. The minimum and maximum. The minimum of the age 13 and the maximum 18.4. And the HbA1c, the number of the sample size at the same, the minimum, so not have any missing data. All the data is have the age and HbA1c, the minimum, the maximum, the mean, just describe the data, the average of the HbA1c in this sample size, the average of the age, okay, the standard deviation, okay? Does it make sense? Now you back, you can, from here, you can using the analysis from output, from analyze, descriptive, frequency. I have the gender is the categorical, okay? You should select the gender from here and just okay. What's the mean? That genders you have valid 389, but they have the missing. What the mean missing? 147 people not answer the gender. Okay, this is the table. The frequency, numbers of the male, numbers of the female, the percentage for male and the female from the total sample size. When the user you say the missing data, sometimes you have the wrong in the data or the enter of the data. You should back in the SPS data view. I will back. What the wrong of the data? Just a minute. Share. Back of the end of the data. Why the difference between the numbers of the age and the numbers of the gender? Okay, you can see it what like point or dot in the cells. You can see this. This is the appear and when the copy paste is the different from the column and the other column. You should cleaning just determine. You can see just determine of this dot and clear. So all the data don't have any dot in the. So back to analyze, descriptive, frequency, and make of the also gender. And go the output. So the genders have no missing data. I will a cleaning of the data and solve the problem of the missing the data. The numbers of the female 198, 98, and the female 206. A percentage of the female and male. Okay, does make sense? I can repeat. Okay. تمام ممتاز الحمد لله. Okay. Okay. Now, how to convert it data from continuous data to categorical data during the SPS. Okay. For example, HbA1c. HbA1c is the continuous data in your research, in my research, sorry, is continuous data. I will back in the SPS output. HbA1c is what continuous data. I wanted to convert it from continuous to what categorical data. So I can first one you should make the cut point. Cut point. I prefer always using the literature review. Back to the literature review. What the cut point of the patient have the diabetic patient is the normal HbA1c or abnormal. Is the different from the literature review based on your country, your different factors. I prefer using the literature review in the Jordan above the 7 or below 7 HbA1c. Above the 7 is abnormal HbA1c among the diabetic patient. Low 7 is normal HbA1c. So go to the how to convert it. Go to the transform, recording into the different variable HbA1c. You can say A1c, just a new name because I will make the new column A1c categorical without a name everywhere, a name in the SPS without a base. We can A1c categorical, okay, change is the wrong variable name contain the algebraical characters. You should without what without space categorical change, okay. all the new value, I will say below 7 or high 7 is normal, abnormal. So lowest 7, so if the patient have the 7, accurate 7, and below 7 is the normal, you say 0. Okay? And high 7, 7.1 is you say value 1, based on your opinion. Okay? 1 is mean abnormal. Okay? Just continue. Okay. Go to the, you have the new column 0 and 1. Okay? You can see. Go to the variable view, make the value 0 is normal because it's low 7, normal A1C, and 1 is abnormal. Sorry, okay, and okay. So, normal, abnormal. You can back the HbA1c first participant. Sorry, back to the first. First participant, HbA1c is 10, is categorical abnormal. The second participant 11 abnormal. You can 6 participant is 5. Yes, have the HbA1c has HbA1c is 6, so is the normal. Okay. This is the converted. The HbA any data is the continuous data, the categorical data. So based on your research, based on the literature review, like HbA1c or any questionnaire is based on your literature review, you back the literature review and know what the cut points and make the cut make the categorical based on the cut point in the literature review. Okay. Okay, HbA1c is the indicator have the patient or have the participant to a diabetic patient or the not diabetic patient. But this is the data from already the patient have the diabetic patients. Okay, already the patient, the participants have the diabetic patient. So we come back to the any literature review. The patient have diabetic patient, if the HbA1c is the 7, she is the good. Sometimes 7.5 or so, it's okay, good, because if they have the many factors you can affect it of the HbA1c, age, what the duration of the disease, and also another comorbidity disease. So if the 7 is the good for diabetic patients, but in the normal people, you should the HbA1c below 6. What are you saying, Abdullah? Just a minute. Yes, I can make the categorical as the period, but not HbA1c. HbA1c is the lab result, so I cannot make the 7 to 5 or 5 to 7 or 7 to 12 or 11, because above the 7 is the very, very high, the HbA1c. You can make the range. Okay, I will back the return another type. Age of age. You can categorical of the age as the period. Okay. From transform, record into the different variables. Reset, because I can use another age. Name, a new name, age, categorical without what? Without space. You can make the range from 13 to 40 is the number 0. The first categorical. Okay, just you should save. 13 to 14 is 0. 41 sorry, 41 to 50 is 1. Okay, 51 to 60 is 3. Sorry, is it, you can say just the minutes. 2, not 3. Not added, just change. Okay, and above, you can say above, or all the other value, you say above 61 is 3. Okay, you should save this with the mean or the numbers is the 2, and above is 61 3, and continue. Okay, you see the new column, new variable, the categorical of the age 0 1 2 3. You go to the variable view, go to the value, determine what the mean of, what the mean 0 in this data. 0, the age from 13 to 14. Okay, just add it. 1, what the mean 1 is 41 to 15. I think that's okay. 2, what the mean 2, 51 to 60. 3, what the mean 3, above is 61. Above. In the label, you can make the space. Okay, just okay. Back to the data view, you can see this is what the mean 0 1 2 3 4, so categorical HbA1c and the categorical of the age. Does make sense? Okay, alhamdulillah. No, above is 16. In the data you're using in the labeling above 61 or 60.9 because just the SPS to understand what the meaning. But I know it's above 60. But 16 not included. Included. Okay. Nominal data. Nominal data. This is the type. Okay, you can back the variable view to determine the measures is the nominal data. Okay. Okay. Okay, then have the categorical data. When they have the categorical data, you can back to descriptive statistic frequency. Categorical data, you can back to the frequency using the new age, A1C categorical, age categorical. Okay, and you can back to the output. Just a minute. You can see output. This is the age in nominal. What the frequency or number of the patient have the nominal A1C and abnormal A1C. You have the missing data, 5 participant or patient don't have the HbA1c. I don't have the HbA1c for 5 patients. Okay, الcategorical الage how the participant or what the numbers of the participants age from the period 13 to 40 and 41 to 50. This is the frequency, the numbers of the participant. Percentage, the percentage of the numbers from the all the sample size. Okay, should back to the A1C. you can read the frequency percent and the valid percent. What the difference between a percent and the valid percent? So the percent is that we can with the missing data. The percentage, the total percent is the 100 with the missing data, but the valid percentage is the 100 without the missing data. So how to write the answer? How to write in the result based on your I prefer using the valid percent because I say the HbA1c number of the HbA1c just 393. Okay, you have the missing data. Okay, so the valid percent using this valid percent, not a percent. You can using the percent. You should make the other categorical missing data. I have the missing data 5 people don't answer the HbA1c. Okay. We don't share the missing data, 5% missing data, you should using the valid percent. Okay? Does make sense? So, repeat different what percent and the valid percent. Okay. The percentage is the percentage for nominal, normal, abnormal, and the missing data. Okay, when the collect or compute the percentage to 100 with the missing data, but the valid percent without the missing data. Okay, in your research, you can using a percent or a valid percent depend you. How? I share the. You can write this. Just a minute. Copy. Just a minute. I will explain that. Okay. Why? Okay, just a minute. Okay, you can see the slides. Okay. Yes, excellent. Okay. Okay. I will explain how to write this in chapters of the result. Just I have that too. You can see this. Okay. Just a minute. This is the table to show the result. The A1C. Okay. Normal. Up. Sorry. And up. Normal. Okay. So this is the percent in numbers, the frequency, and the percentage. Okay. You can use a percent or a valid percent. I prefer using in this tables a valid percent. Why? Because in normal numbers 139 and the percentage you go to the valid percent 35.4 percentage, or just some people go to the percent, not valid percent. First one 34.9 percentage, and abnormal numbers 254 and the percentage 63.8 percentage. Okay, when they see these numbers, you can accumulate the percentage, not the 100. 34.9 sum with the 63.8, not the what the 100 percentage. you have the missing data. Okay, because I'm using the percent. You can using data, but you should added the missing value in here and keep at the same percentage and share of the missing value 5 people not answer and the percentage of 3/100. Does okay without this missing value and using the present with present just present of normal abnormal is not correct. Okay, but you can using the valid persons without the missing value, just clean the missing value and using the 35.4 and 64.6. Okay, this is the accumulate or sum this numbers or the percentage as 100 is the okay. Okay, and you can more explain for in your thesis just numbers 393. Okay, does make sense now? Okay, the valid percent without the missing, I cannot share the missing value is the 100. The percent you should share of the missing value. Okay, excellent. Alhamdulillah. Okay. Also, you back to the SPS. So, this is the data is the cleaning. Okay. Coding of the data with the mean male and female and make the converted the age or HbA1c to categorical. Based on your research, you can convert it, you can keep it of the as the continuous data. Based your opinion, your research, based your research questions. Okay. Now, K1, you say the K1 is the Kelser stress. This is the questionnaire about to assess the stress among chronic patients, especially using a diabetic patient, but you can using the for cardiovascular disease also and any chronic disease. So K1 to K6, this is a 6 questionnaire. You can using from 0 to 1, 1 to 5 answers based on the research based on the recent paper or based on the literature review, based on the authors write the questions, 1 the none of the time, 2 the little of the time, 3 the some of the time, and the 4 most of the time, and the 5 the all the time. Okay, now the first research question you to how to assess the stress among a diabetic patient. Okay, how to answer these questions. I have the 6th questionnaire to assess the stress. This is the tools. Okay, you should convert it as the 1 column. I have the 6 questionnaire. Okay, each question to answer from 1 to 5. The patient answer from to 5. Okay, but I will need it to convert this questionnaire to 1 column because I wanted to assess the stress level among a sample size. How to make it? Okay, I will say variable, sorry, data view, back to the data view, you can. This is the numbers you can get. Just go to the transform, compute variable. You sum the questionnaire from 1 to 6 to make 1 column because I wanted to assess a level of stress. How to assess a level of stress based on the 6 questionnaire. Okay, just target variable, you can say a total stress or without target value without ايش okay without space. Go to the K1 plus K2 plus question number 1 and question number 2 in the culture 3 plus 4 plus 5 and plus what 6, sorry. Okay, you can go to the data view. You see the new column, total stress. I can just transport in here. Just a minute. Okay, this is the 10. What does that mean 10? K1 is answer 1, 2, 2, 1, 3, 1. Just sum of these numbers, 1 plus 2 plus 2 plus 1 plus 3 plus 1, they accumulate to 10. This is the level of stress for participant number 1. Okay? And the second participant have the stress level of 17, 12, 9, 13. Okay? This is the total score. Okay? Does make sense? This is the total, make the total score based on the literature review, because this is the questionnaire. Kelser is the 6 items. Okay, 6 items. I have to assess total stress for participant. You should sum of the questionnaire as the one column, just to sum of the every questions. Okay, just the column. How to answer the question? To assess the total scores or assess the stress among the diabetic patients. How to answer a question? This is the total score. This is the column. How to answer the question using the SPS? Just go to the analysis. Okay. Before that, a total score is the continuous or categorical data is the continuous. So you go to the descriptive statistics. Okay. Go to using the total scores. Okay. You back to the outcome. You can see the outcome. Okay. You can see this is the outcome of a total stress in numbers of the participant. Total stress 398. El minimum of the total stress is 6 and the maximum 13. El median or el mean or el average of participant 17.4. So you can answer the question, assess the self-efficacy among a diabetic patient. The average of the stress among a diabetic patient was 70.4. Okay. Now we answer the first questions. Okay. Because to assess the stress, I have the total score of the stress, the total score as the continuous data, so you can make the descriptives to assess descriptive. I cannot using the association, just assess or evaluate. Using a descriptive statistical, if the data is the continuous data using the mean or standard deviation or a median, and if the data categorical using the frequency and the percentage. Okay? Okay. You can convert it the total score stress as the continuous to categorical data, yes, based on the literature review. If the authors go to have the cut point, make the cut point, you can convert it. Okay. 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 I say if mean and median. What the difference between mean and median? What the time to use mean and the median for the continuous data? Okay, I will see. El mean to continuous data, also median for continuous data. But what the difference using when what the time using the mean and what the time using the median. If the data, the continuous data, is the normal distribution, using the mean and the standard deviation. If the data non-normal distribution, you cannot using the mean, you should using the median. Okay? Does make sense? I will repeat. I have the total score for outcome, okay? This is dependent variable because the research question to assess, what are you say? To assess liver stress among a research question to assess a liver stress among diabetic patients, or can't you say type 2 diabetes patient in Jordan. Assess or evaluate using descriptive, okay? Level stress, and based on the questionnaire, based on the tools is the continuous data, just total scores. So you can continuous data. Assess descriptive statistical using descriptive, mean, median, frequency. Level stress is the continuous data using the mean or median. Based on the type of the level stress, the total score is the normal distribution or not normal distribution. What the mean normal distribution, what the mean non-normal distribution. In normal distribution, when the continuous data as the normal distributions is the data is the normal. How to check is the data normal or not normal distribution? We can go analysis, descriptive, exposure, and check the output of the total scores. Check OK, and the answer. This is, you can see the test of the normality. Okay? If the data is the significant above the 0.05 is the normal distribution. Okay? Below 0.5 is the not normal. You check outliers at the same outliers, but you can the perfect test. You can test a test of the normality. Okay, the two tests, Schaber. Okay, if the two tests not significant, it's above the 0.05, you say the normal distribution. But is the low, is the significant, you say non-normal distribution. Okay, I will go to the SPS. Okay, I have the total score of the stress. So this is the continuous data. This is the outcome. Is this outcome? What the mean outcome is a dependent variable. So you should descriptive because to assess. And go to the is the normal or not normal distribution. Analyze. Exposure. It depends. It total score. Just using the depend list. Statistics. Descriptive. Okay. The plots and normality plots of the test. Okay. You can using a histogram, but this is the test, the major test. Okay. Okay. Go to
Salma,
the out. What?
Salma, can you conclude in coming 2 to 3 minutes? So we have run out of time for 12.
Okay. Okay. Just the 1 minute.
Okay. Okay. Thank you.
Okay. I will share the output. The last one. Okay. You can go to the test normal. This is what the mean is the significant is below 0.05. So the test normal stress is non-normal distributions. Okay. Okay, based on the Chuber test, and you can see the histogram is not symmetric, non-normal distribution. You can see also a normal QQ board is the not in the line. And the box, you have, I don't have outliers from here, but is the non-normal distributions, okay, based on the test of the normality. So when the data is the not normal distribution, the descriptive assess level based on the median, not normal, not the mean, okay? Does make sense? Any question? Any question? Okay, I'll be back. So today, just to talk about how to make why is the research question is very important, because when the assess research questions is clear, you can detect the dependent and independent variables. And think after that, dependent and independent variable, you should determine the types of the data. When the determine the type of the data, you can easily determine the statistical tools, okay? First one, the descriptive, is you can using descriptive statistical just to describe of the data. You can using the mean and the median for continuous data, okay? If the outcome is continuous data, you should using the median or mean based on the normal or not normal distribution. And if the data is the categorical, using the frequency and the percentage, okay? Any question?
Okay, thank you, Salma. I hope we had a grateful time and session. So we are grateful to our speaker for sharing her time and expertise with us. And those who are asking for the presentation, we will share this recording of the meeting on our YouTube channel within 2 to 3 days. And those who are asking for attendance, their attendance are automatically marked when they join, and we have their data. Don't worry for the attendance. And inshallah, we will meet tomorrow at the same time, 10 a.m. to 12 p.m. and have an interactive session. Thank you so much, Salma, for your time.
Welcome. Thank you, Javina. Any question you can ask me now or last time in the second lectures, inshallah.
Yeah, inshallah. So, thank you. Yeah, winding up.
Okay, thank you.